I'm Kathy Wolf, Thurston County Commissioner, and I have heard Jonathan Seib described as one of the sharpest, most innovative, most intelligent, most creative healthcare policy thinkers in the entire state. Jonathan is a real big picture thinker. He deals at the state level, but he also knows how to bring that policy down to the local level.
I'm Kristen West, and I'm the Vice President of Programs for Empire Health Foundation in Spokane, Washington. So prior to working at the community level, I worked in state government for quite a while, and I happen to know that state employees, especially in the policy realm, have a responsibility to think about what's good for the entire state and to have some consistency statewide in terms of their policy. Fortunately for us, Jonathan and his wife Patty have raised a family here in Olympia, so have an inherent interest in this particular community.
I'm Jonathan Seib, Executive Policy Advisor in Governor Gregoire's Executive Policy Office. One of the fringe benefits of the state capital being here in Olympia is probably the responsibility, I would almost say, on the local community to be amongst the leaders in terms of engaging with and providing comment on, sometimes being the guinea pig, if you will, for innovative healthcare ideas. I think one of the innovations we have tried to integrate in much of what we've done reflects this notion that in the end healthcare reform is very community-based activity, that healthcare is very community-based activity, that it can benefit from the relationships that exist within a community and build and grow on those.
Most recently, several of us have been working with Jonathan Seib on organizing something that we called a RIC, a Regional Health Improvement Collaborative. We are attempting to get folks from 5 different counties, Thurston-Mason, Lewis, Pacific, and Grays Harbor, to sit down at the table. People that don't normally talk to each other. And we're talking about folks from hospitals, folks from county commissioners, public health officers, folks from law enforcement. All of us are dealing with the same populations. We're trying to focus our efforts on the 5% of the Medicaid population that utilize 50% of the resources. And we're finding that together we're stronger, that if we bond together we can have a much better collective impact. And Jonathan has been a great help in moving these efforts forward.
Just to talk to him, you understand his depth of knowledge and his commitment to healthcare quality, healthcare access, healthcare cost issues, and all of the other associated issues. He understands it not only at the system level and at the policy level, but at the heart.
One of the greatest things I like about Jonathan is I will pop by his office unannounced, and this is a person who is hounded with people wanting his attention and his time and probably has almost no time to sit and think in his office, and yet he always greets you with a smile. He always asks how things are going, and he always ends the conversation with, "Was this helpful to you? Did you get what you needed here?" He's an example of a true public servant.
I appreciate the recognition. I don't know that there's any of us who do this for the recognition it brings. There's so much work yet to do that there's also a part of me that wants to insist that no one is yet deserving of recognition. We still have too many people who are uninsured and too many people who don't have access to the care that they need. Too many people who may have insurance and access but are not receiving the quality of care that they deserve.
We could not do this kind of thing without people like Jonathan Seib supporting us. This is one of the things that I appreciate the most about Jonathan Seib. Jonathan, you truly deserve to be recognized as a healthcare champion. Thank you.